All right, you guys, hold on. This one's going to be feisty, I think. What are your thoughts on those recently graduated jumping into private practice? It seems that the message has been to work at agencies or treatment centers for a few years to gain experience before starting your own practice. I'd like to thank Therapy Notes for sponsoring us today. So the message is to work at agencies and treatment centers to gain experience, but I don't necessarily agree with it. I have a few problems with it. So let's start here. First, I don't like that we're encouraged to cut our teeth on populations that may not have the resources for private practice, or the people who are in residential or higher levels of care who need really great care. I think it insinuates that their care is less important because it's insinuating that you are less good if you're not ready for private practice. So those are my two huge problems with it. I think we all deserve great care. I have also known a lot of therapists who were great right out of the gate, better than some of the supervisors I'd had. And speaking of supervisors, one of the perks of most agencies is having an assigned supervisor. And that's amazing when it's somebody who cares about nurturing the next generation of therapists, someone who's doing their own clinical work still and is still learning best practices and innovations in the field. It is not great when it's a supervisor who's burned out, not seeing clients anymore, and teaching you what they learned in grad school 25 years ago. Just because you're assigned a supervisor doesn't mean you're getting great supervision. I think that probably most of us have at least a little experience with that, unfortunately. I ended up paying out of pocket for amazing supervision when I was in an agency because the supervision I was provided in one job was really horrendous. And I had some great ones in other workplaces, but if I'd stayed with her, the one that was so bad, I would have had to unlearn years of patterns that would have actually done damage to my clients. I've worked with a lot of consulting clients and supervisees who have had that experience. So for one thing, I just want you to know, if you've got a supervisor and you think like they're not doing a great job, first of all, talk to them. I mean, don't say you're not doing a good job, but talk about your concerns and what you're looking for in supervision and see if they can meet it. And if they can't, that's why we have private supervisors. If you know you want to be in private practice, maybe you went into grad school with private practice in mind, or you learned throughout the process that that's what you wanted, and you have a license that allows for immediate private practice, which a lot don't, and you know what modality or client population you want to work with, I highly recommend going into private practice and securing outside supervision. Interview supervisors and know that how you practice therapy is going to mirror the way they practice therapy or the way they're teaching you in ways you might not realize. So be as discerning as if you got to choose, just choose whatever therapist you wanted for the person you love most. You will, for better or worse, live out what you're learning from this person. People are going to continue to tell you that you should have gone the agency route. But if you want to work with women with high functioning anxiety, you're going to get much better experience treating a caseload full of women with high functioning anxiety and talking through things with your awesome supervisor while working much less than 40 hours and taking time and money for self-care than you will working at community mental health, seeing a few at a time if you're lucky, and wishing that that $15 yoga class wasn't so darn expensive. Sorry, I'm about to turn this into a rant. Now, if you're not sure what your population is, which population you want to work with, and you want more support than supervision is going to provide, then consider a group practice that has a really great reputation and low turnover. There are just as many shady group practices as there are shady agencies, so please be picky. That way you're going to get a varied caseload, you're going to have some support, and you're also probably going to have better work-life balance and probably better pay. And remember, you do not have to go into private practice now. If you're somebody who's listening to this and is like, I don't know if I'm ready. If you don't think you're ready, it's okay. You're a baby in your career. I've been a therapist since 2004, and I'm still a baby in my career. So we have plenty of time with this stuff. There is no rush. I just want to make sure that you are enjoying your life and your work and learning really good skills in the interim. That's what I got for you today. If you have questions, please send them to me at ask@abundancepracticebuilding.com.